When you hear the word concussion, your mind probably jumps straight to the brain. And you're not wrong. But what we're learning is that recovery is so much more than just resting in a dark room. Today, we're going to dig into the powerful and, honestly, often overlooked role that physical therapy plays in getting you back on your feet after a concussion, all based on the official clinical practice guidelines.
Okay, let's just get right to it, because this is a fantastic question. If the injury is in your brain, why on earth would you go see someone who specializes in muscles, joints, and movement? It seems kind of weird, right? Well, as it turns out, the connection is incredibly direct, and it's absolutely crucial for recovery.
You see, a concussion doesn't just rattle your brain in isolation. It throws off all the complex systems that your brain is in charge of. We're talking about the very systems that control your balance, how your eyes move, and even how the muscles and joints in your neck are working. And those systems, that is a physical therapist's home turf.
So, here's our game plan for today. We'll start with what you can expect in that very first appointment, the screening. Then we'll dive into the comprehensive exam, craft your personalized recovery plan, and finally, talk about what your path to recovery actually looks like.
All right, let's start at the very beginning, that first appointment. Before any treatment can even be considered, the absolute #1 priority is to make sure that physical therapy is a safe and appropriate next step for you.
I love this analogy. Think of your physical therapist as a detective arriving at the scene. Their initial job isn't to solve the entire mystery right away. Nope. It's about securing the area, checking for any immediate dangers, and just making sure they're on the right trail before the full investigation begins.
And that initial investigation really boils down to 3 key steps. First, they have to rule out any emergencies. They're screening for any red flag signs that mean you need to see a different medical provider, like right now. Second, they'll use symptom checklists and your personal history to confirm that what you're feeling really does align with a concussion. And finally, they determine if your specific issues, dizziness, neck pain, balance problems, are actually things they can help with.
So, once you get the all clear and it's determined that PT is the right move, then the real investigation begins. This is where your therapist starts to dig deep to pinpoint exactly which systems got knocked offline by the injury.
The clinical guidelines point them to 4 main areas to look into. Now don't worry about the long technical names. We're going to break each one down. They are your neck function, your vision and balance systems, your body's tolerance to physical effort, and your overall motor control.
First up is what's called cervical musculoskeletal function. That's really just a fancy way of saying, how's your neck doing? You see, the same force that causes a concussion can also cause a whiplash-type injury. And if the muscles and joints in your neck are out of whack, they can be a major source of those nagging post-concussion headaches and dizziness.
Next is the vestibulo-oculomotor system. Okay, let's break that down. Vestibular refers to your inner ear, which is a huge player in your sense of balance. Oculomotor is all about your eye movements. So this system is all about how your brain, inner ear, and eyes team up. When that connection gets fuzzy, you can feel dizzy, off balance, or have trouble focusing your vision.
Third, they're going to check your exertional tolerance. This looks at how your body's automatic pilot, the system that controls things like your heart rate and blood pressure, is handling activity. After a concussion, the system can get really out of sync, which is why a simple walk up the stairs might suddenly leave you feeling foggy, exhausted, or really dizzy.
And finally, there's motor function. This is about higher-level control. Can you walk and turn your head at the same time without losing your balance? How's your coordination? This part of the exam is checking how well your brain is communicating with your body to pull off more complex, coordinated movements.
Now this is where that detective work gets really interesting. A symptom like dizziness isn't a diagnosis. It's a clue. Is it coming from a problem in your neck? Or is it actually coming from your inner ear, a condition called BPVV? Same thing with a headache. Is it coming from muscle tension in your neck? Or is it actually eye strain because your eyes are struggling to work together? A PT's job is to figure out the source so they can treat the right problem.
So, after that whole thorough investigation, what's next? This is where all those clues come together to build a treatment plan that is designed specifically and only for you. There is no one-size-fits-all, cookie-cutter approach here. And this is a core principle, straight from the clinical guidelines. They say that the plan must be personalized. It's built around your specific impairments, yes, but also around something really important they call your level of irritability.
This brings us to a huge shift in concussion care. The old advice was often just to go lie down in a dark room and wait. That's passive rest. The modern, evidence-based approach is active rehabilitation. It involves carefully prescribed, guided activities designed to actually retrain and heal the very systems that were injured.
So what is this irritability level? Well, it's simply a measure of how easily your symptoms get triggered. Are you highly irritable, meaning just a little bit of head movement makes you dizzy? Or are you less so? Your PT uses this to dose your exercises perfectly, just enough to challenge the system and promote healing, but not so much that it causes a major flare-up.
So let's bring this all home and look at your recovery. This isn't something that just happens to you. It is an active journey that you are a huge part of.
And this illustrates that point perfectly. Recovery is a partnership. Your physical therapist is your guide. They've got the map, they have the expertise, but you are the one driving the journey. Your participation, your effort, and your feedback are absolutely essential for success.
And here's the really empowering part. Recovery is not a waiting game. The science shows that being proactive really pays off. Evidence actually suggests that starting physical therapy earlier, once it's deemed safe, of course, may help you recover faster than just waiting for symptoms to go away on their own.
Ultimately, the goal isn't just to get rid of your current symptoms. It's to retrain your neck, your balance, and your vision systems so that they're more robust and resilient. It's about moving from simply managing problems to building a stronger foundation for the future.
So we'll end with this question. Based on everything we've just seen, after concussion, is just rest really enough? The evidence points to a clear answer. An active, guided recovery with a physical therapist may not only be beneficial, but for many people, it might be absolutely essential.